Friday, or actually it's afternoon now. This is our final day of Brain Health Week, and it's been very exciting and very enriching. We've learned a lot, and we've had great guests with us, and today we have another great guest. So excited and privileged to have Heid with us today. And Anne is the Senior Technician for Hyperbaric Services of the Palm Beaches, which is right across the courtyard from us. I should have introduced myself. I'm Hillary Loftus, the Healthcare Education Director for the Howe Foundation. So I'd like to say welcome to Anne, and
Thank you.
it's great to have you here today.
I'm glad to be here.
And we're just going to have a little conversation so we can learn more about you and what you do, your experiences with hyperbarics over the years. So I know you've been in the hyperbaric industry for a long time. How long have you? When did you start working with
I've been in the field for over 25 years. Just happened to be at the right place at the right time, working for a physician who got involved in it, and that's how I got my start.
Very interesting. And where was that, Anne? Was it down here in Florida?
Yes.
Oh, it was?
It was
Okay.
in Florida.
Mm-hmm. And are you from Florida originally?
No.
Okay.
Born and raised in New York.
Oh, okay. Moved to Florida a long time ago,
Yes.
and
Yes.
all the other smart people learned about hyperbarics when you were down here, and
Yes.
you've been working with it ever since. Excellent. Does hyperbarics, I know hyperbarics supports, 13 or 14 diagnoses now that are paid for by medical insurance and Medicare.
Yes. 13
13 diagnoses paid
diagnoses.
for by Medicare
Yes.
and insurance. And does hyperbarics support brain health as well?
Absolutely. Hyperbaric is used for neurologic as well as wound care. Not that the insurance companies cover the neurologic end of it, but yes,
Yes.
over the years, treated many, many patients with a variety of neurologic conditions.
And you've seen them improve and have a different quality of life than when they came in.
Absolutely.
Mhm.
And I mean, going from infants all the way up to treated some patients over 100.
No kidding,
Yes.
over 100.
Yes.
Interesting. And what were their diagnoses? Can you remember?
Well, there's a variety of diagnoses that we cover.
Mhm.
And in the neurologic, stroke, MS patients, Lyme encephalopathy, multiple sclerosis, children with CP and autism. And
CP
it goes
means
on.
cerebral palsy. Okay.
Yes.
Mhm. And Lyme encephalopathy.
Encephalopathy. Yes.
Yes, it's hard to say.
Yeah.
So is that advanced Lyme disease or?
Yes, usually you find when it starts
Mhm.
affecting the neurologic end that they've probably had it for a while and it's been left untreated.
Okay.
So they call it latent stage Lyme disease when you usually see the encephalopathy.
Okay, thank you. And what about the strokes? Are those something that you think it's good to treat right away, or that you've seen more success right away, or after a period of time?
Well,
or?
with the stroke patients, you want to
Mhm.
get them stable first before you bring them in, and then you want to use the hyperbaric as an ancillary therapy along with whatever is deemed necessary for their said condition, whether it's physical therapy, speech therapy, or OT.
Mhm.
And using it in conjunction, we have seen some really wonderful results.
So the hyperbarics helps the physical therapy outcomes and occupational speech outcomes maybe go deeper or faster, or the physical therapy.
Well, what you have with the stroke patient
Mhm.
is you have the area of injury, or infarct as they refer
Mhm.
to it. And you can't bring that back. So
That's
it's
in their brain.
Yes,
Mhm.
it's like rerouting it, so it's doing retraining all over again.
Mhm.
Again, whether it's speech, physical or occupational therapies.
Mm-hmm. And hyperbaric actually wakes up the
The
cells.
idling neurons. Yes.
island neurons
Yes.
around
The area of infarct, yes.
okay, right. And if those cells weren't reawoken, the person wouldn't have as much range of
Ability.
activity.
Yes.
Mhm.
Yes.
Interesting. So good.
Same thing with
Mhm.
your traumatic brain injury patient. You
Right.
see the same type of thing when they get the injury to the area.
Like for a concussion or
Exactly.
something like that, blast-induced concussion or a regular concussion from a sports injury or a fall or something
All of
like
those
that.
fall into
Mhm.
that category of the traumatic brain injury, yes.
Is there a particular patient that you could tell us about, let's say with stroke, maybe how they were before they came in and
Well, we've treated several patients that have come in and were wheelchair bound and having their hyperbaric and doing their therapies. We've had them after anywhere from 20, 40, 60 treatments, able to get up and walk, whether it's, with the help of a cane or a walker, and actually start walking again.
It's fantastic.
It's
And-
exciting to see.
Yeah, that's very exciting. They must be so thrilled, and their families must be so thrilled.
Yes, it's quite a burden for the caretakers.
Right, yeah, believes that, yeah. Let's see, and how, they're in a wheelchair, so is it just when they're stable, the patients that you're thinking about, just after they've been stabilized, or maybe did they have a stroke a long time ago and they've been in the wheelchair for a while, or have you seen both?
I've treated both. I've had the recent stroke patients, and we've had ones that have come years after, 3, 5. I've treated some that are 10 years after.
No kidding.
Mhm.
That have been in a wheelchair, and then after the
Yes.
hyperbarics, they're able to get up and walk with the help of a cane or a walker?
It depends on the individual, and again, along with the therapies that follow.
Right,
Yes.
of course, yeah, the
Yes.
physical. Excellent. That's great. Saves a lot of trouble and expense for everybody for the future, and such a
It
better.
does, and it lifts up their emotional end too. And they feel like they're making progress and they're going along. So it works in many different ways.
Yeah, wonderful, and for the families, as you said too, and yeah, the independence, the increased independence they're able to have. Yeah.
And it gives them that little bit more positive, part of their life.
Gets rid of the depression, makes them
Helps, yes,
yeah.
with the emotional end. yeah.
feel happy again. What about, say, concussions or post-traumatic stress with any of the veterans or the athletes, you
Yes,
treated?
We have treated several veterans at this time, and they come in usually with the traumatic brain injury in conjunction with the PTSD, which is
Okay.
the post-traumatic stress
Right.
disorder.
Yes,
And they have, a lot of them have difficulty with sleeping disorders,
Right.
and a lot of them have done much better with that. A lot of them emotionally wise, depression and all. And when they start getting back some of that regular sleep, their body reacts again in a better way, and their frame of mind changes to a more positive outlook.
Right. That's, very rewarding and encouraging. Is there any one that you'd like to speak about in particular? We can't say their name, but if there's someone you'd like to focus on.
We had one that came, and he was in a down, depressed mood at the time,
Right.
and kind of unsocial at the time. And we're very caretaking facility,
Yeah.
so
I know
we
you've
kind
all
of
been together for
uplift
a
their
long
spirits
Yeah.
when they come. And when he left, he was physically feeling better,
No more
sleeping
headaches.
better.
Or,
No more headaches. Uplifted. Even his wife saw a definite change in him.
So nice.
Became more back to his self, as family oriented and all. went on to just recently have a beautiful baby boy.
Right, that's so exciting.
And
Yeah,
Very
make that
thrilled.
possible.
Yes.
That's such a great outcome because so many of the veterans, I mean, they get depressed or they have post-traumatic stress, and then some of
Yes.
them in a bad way, they commit suicide. And to be able to take someone who's been in a very bad way, you know, like that, I don't know if he was suicidal or not, but you say, I know, you know, it sounds like he was in a very bad
A
way.
lot of them are depressed to start off with.
Yeah.
So anything you can do to help them, and this is a
Right.
more natural way of helping them along.
Right.
So, and it
It's
helps
not
put
the
them on the
drugs.
path.
Yeah. Was he on a number of drugs? Do you remember? It's probably hard to remember, and I know you like to.
Truthfully, I don't really remember,
that's
but
okay.
a lot of them do come in,
Right.
you know, on a lot of drugs.
Medications. Yeah.
Yes.
And then have you seen that the hyperbaric oxygen therapy helps them reduce their number of medications, or does it affect that at all?
A lot of them go back and they slowly start, because a lot of these medications, you just can't take them off, and they start
Right.
weaning them down slowly and start removing them.
Right. Which
You
is
know.
wonderful. Yeah.
Oh, absolutely.
Yes.
Because a lot of those medications have other side
Side
effects,
effects, right.
which
Yeah.
sometimes enhances what they have to start off with.
Okay, yeah, something that you wouldn't want to continue for years on end. Yeah. Excellent, thank you. Is there anything else that you can think of? Do you want to run down, let's see, besides traumatic brain injury and concussions and stroke, what other diagnoses have you treated in your career or at Hyperbaric Services? Sorry.
There's so many.
I know it's oxygen, pure oxygen, which
It's
our bodies
100%
love,
oxygen
right?
under
And
pressure.
It helps, yeah, just about everything.
Helps with inflammation throughout the body, so
Right,
anything, you know,
Yeah.
that causes any kind of inflammation. I mean,
Right.
we treated patients with tinnitus, we've
Oh,
treated
so thank you for
patients
that.
with gastrointestinal problems, such
Okay.
as ulcerative colitis, and we've treated patients with urinary tract issues.
Okay, because it gets rid of the infection.
You know, a lot of men with the prostate problems we've
Right.
treated. So
Wow.
there's been a variety of things, and I mean, a lot of them.
So do you have, so if someone thinks that, is wondering if hyperbaric oxygen therapy could help them, should they call you?
They
Do you
can
have-
call over to the
Right.
office.
And you have a doctor there that can answer
Yes.
any questions?
Yes, they can call the office at 561-819-6125. They can go to the website, which is palmbeachhyperbaric.com.
Excellent. Well, that's great, and thank you so much for taking the time from your patients today to share all this great information with us. Really appreciate it.
I appreciate you having me. Thank you.